is everybody these days has a smartphone. Everybody's starting to use wrist-based wearable devices. And in the last few years, I was fortunate enough to be involved in a study that showed that the Fitbit that a lot of patients have, and previous to that, the Apple Watch that a lot of folks have, can be used. It's been cleared by the FDA as a mechanism of diagnosing a common heart problem called atrial fibrillation, which is actually the most common heart rhythm problem in the United States. A lot of people have it. In fact, if you live long enough into your 70s and 80s, it's about 1 out of 4 people that have it at that point. And I would just say that whereas before, episodes would come and go, and someone would come in to see me in the office and say, 3 weeks ago I had palpitations, or I felt a little something in my chest. It's gone now. Their EKG in the office looks fine. I'd have very little ways of figuring out what was going on with that person, and I might miss their AFib. And AFib is serious. It can lead to problems like stroke, clot that travels to the brain. And so the Apple Watch and Fitbit devices that are now available allow for the earlier diagnosis. And I think they're transforming how patients are self-diagnosing in many cases for this common heart problem. So you may be reading about this in the New York Times or seeing articles about this in the lay press. And I just would say, I absolutely would say at UMass Memorial, we're at the cutting edge of being able to integrate that information from your devices into your care and making recommendations about what you should be doing. Now, not to say everybody who has, needs to run out and buy an Apple Watch. That's not what I'm saying. They're expensive. And, I recognize that in younger people, you may not do anything with AFib, but for your mom or your dad, you may want to think about, pitching in for something to monitor them in a different way. And this is a really exciting avenue via which patients are getting empowered. They're able to make a diagnosis, and please use your Epic My portal to send that data into us. We're happy to take a look at it and facilitate your care. Very, very exciting technology. So one of the other really unique things that I'm aware of at UMass Memorial is we are launching the first in-human gene therapy study for AFib, that condition I mentioned earlier, that heart rhythm problem. So we have a cardiologist named Dr. Kevin Donahue who has invented a new treatment for this previously unpreventable, untreatable heart rhythm problem. So instead of waiting till you get it and diagnosing it with your Apple Watch, his theory is, well, we know some of the genes that contribute to this problem, and we're offering to patients who have surgery at our hospital a treatment that's delivered during the surgery where a gene therapy is applied to the heart, just the heart, not the whole body. And that is the FDA has approved the trial, the National Institutes of Health have approved the trial, and the only place in the world you can get that treatment is at UMass. How cool is that? So that's another example of the type of very unique care that you can get if you come here that you can't if you go to other places.